My PhD research is focused on understanding the support structures available to trauma-exposed refugee children and their families living in two different low and middle-income countries, Iran and South Africa, and how this support might influence their trauma-related mental health in this population. I think it would be really important to generate more knowledge and data around those vulnerable populations.
Your project is concerned with thinking about how the social structures might work to make things easier for refugee children who are struggling with their mental health. Do you think that this is especially hard for these families because they are so focused just on scraping by? Are we asking too much maybe to think that they also need to be worrying about their children's mental health?
I think your definition, there is no health without mental health.
Yeah.
And the best we can do is firstly try to develop some international framework or to recognize their needs.
Yeah.
And then following that, hopefully develop some interventions or programs to support them as much as we can, I think.
Yes, I agree, actually. And I think sometimes there's this idea of a hierarchy of needs and that you can only worry about the needs a little bit lower down if the needs at the top are met. But families that you've interviewed, this is also something that they would welcome, you think?
They would like to have more access and get more support from some charities, NGOs, some levels of support from the government when you don't feeling of belonging to the new society. So it's really hard to expect you're going to get some mental health support.
I guess the other thing is that we wouldn't have been able to do this work without you being yourself from Iran. What's it been like for you?
It was really helpful to know the local language, some networks and established links with local NGOs and charities, and all together make it possible to recruit really hard to reach population and participants. And at the end, I think it wouldn't be really possible without having all the supports I received from yourself and supervisory team and even the university. I think we've done, hopefully, really good contribution in the lives of these refugees.